Hello, everybody, and welcome to City of York Council's first Facebook Live event with councillors and leaders from different organisations, both in the council and also from our CCG. So I really hope this is going to work. We're all learning to do things very differently. So councillors working from home, the council's about to use Zoom for our first public meetings, and I know all of our different partners are learning and working in very different ways. So we're doing the Facebook Live, hopefully to give you a chance to ask us some questions and also chat with us via Facebook about the answers that we're given, some of which you might like, some of which you might not, but we hope that it's going to be a useful hour with you. You'll know that York as a city has had a fantastic response by working together. We've had over 3,500 volunteers come forward, and I'd like to give a big thank you to all of those volunteers and voluntary sector groups for really stepping up, getting involved, helping their neighbours, their families and their communities through what we know is a very difficult time for everybody. And likewise, council staff I know are going above and beyond, for example, over the recent Easter bank holiday weekend, working, making sure they were processing business grants and support for individuals all that time. If you don't know who I am, I'm Councillor Keith Aspden. I'm the leader of City of York Council and a local councillor in Fulford and Heslington. And what I'm going to next do is introduce each of the guests, so to speak, on the panel. And apologies to everybody for the numerous mistakes that I'm probably going to make in directing questions whilst monitoring Facebook Live as we go. And they're each going to introduce themselves, say why they think they're here, and in a sense what their specialist topics are. So I'm going to go to Ian Floyd first, and then I'll go round. Ian.
Thanks, Keith. Just to say, I'm the head of paid service for the council, so I'm responsible for all the employees of the council. So obviously, probably come on to it shortly. My job has really been ensuring coordination across all of the council services to the crisis, and ensuring our response has been the most effective we can make it.
Thank you, Ian. And next introduction, I'll go to Dr. Andrew Lee. And thank you as well, particularly Andrew, for joining us on the call.
No worries. Thank you very much. Good afternoon, everyone. So my name is Andrew Lee, and I'm the Director of Primary Care and Population Health at Vale of York CCG. So my role's mainly been helping organize and coordinate health services in our region. And I've done this with our local authority counterparts, such as Sharon, who's on the call today as well. Thank you.
Thank you, Andrew. And leading on, Sharon Stoltz.
Hello, everyone. My name is Sharon Stoltz. I'm the Director of Public Health for City of York. As part of my role, I'm responsible for protecting the health of the population. So I've had a lead role in terms of providing specialist advice and support to the pandemic response in the council.
Thank you, Sharon. Andy Dagorn.
Hello, I'm Councillor Andy Dagorn. I'm the Deputy Leader of the Council and Executive Member for Transport, Highways, Communications, those sorts of things. I'm also Ward Councillor for Fishergate area. And the reason I'm here obviously is to answer questions, and like everyone else, we're all learning how to use this different technology and try and use this opportunity to try and connect in as many different ways as possible with the residents, given we can't go and knock on your door and talk to you in person. This is the next best thing that we can offer, is to try and talk to people and answer questions and represent your views on the City of York Council.
Thanks, Andy. And Paula Widdowson. Oh, you just have to unmute yourself, otherwise the world won't be able to hear you.
Sorry. It's just he always likes keeping the mute button on me. It keeps me quiet. As I was saying, it's Paula Widdowson, Exec Member for Climate Change and Environment. I'm a ward councillor in Dringhouses and Woodthorpe, and I'm here this evening to talk about waste and environment.
Thank you very much. And really the aim for all of us in this live Q&A is to address some of the key topics that you've already raised. And I thank those that have already submitted email questions to the council, really to explain some of the council service changes, some of the questions that you might have on public health and what's happening around us at the moment. And also a little bit to start talking about how the outbreak is affecting us in York, but equally how we're starting to look to the future and what we can continue to do to support you and businesses throughout this whole time. So now you've learned a little bit about all of the participants on the call. What I'd like to sort of say is what some of the themes are going to be that we're going to talk about on the call. And as I say, that the 6 themes that we've selected from the start are the ones that we've had most questions on from the people that have submitted questions in advance. And I will try and say who are questions from without identifying them, so you can see that they're real questions that have come in to us. So the 6 main themes that came across were questions on green waste collections, changes to services, household waste recycling centres, dentistry, homelessness, and then the environment and climate change. But that's not to say that I won't throw in extra questions that either come in on Facebook or that we've had emailed in advance. And that would be quite fun for me to pick the unsuspecting participant as to who can answer that question for you all. And I do encourage you on Facebook, if you're following, to use the chat function there to make sure you're sending any questions to us as we go. And also in response to the answers that we're given, we won't be able to get through all the comments and questions, but we'll do our very best to cover all of the topics. And on that note, our first question, which was submitted in advance, was on green waste, and this was asked by a local resident, Steve. And the question he asked was, with the warm and dry weather conditions experienced in past weeks, and since government lockdown restrictions have meant more people working and being at home, there is a real need to start the 2020 green bin collections, as more people have been gardening since mid-March. Indeed, gardeners have nowhere to currently take their garden cuttings, as waste recycling sites are closed and green bins are already full. I urge City of York Council to reconsider starting green waste gardening collections as soon as possible. And I'm going to ask Paula, as the relevant executive member, to kick us off answering that question.
That's a really good question, Keith, and very, very good one from the resident. And everybody, excuse me, absolutely everybody is frustrated that the green bins cannot be collected. The reason that we took the decision, and trust me, none of us took this decision lightly, was to ensure that we could keep the social distancing in the waste crews. So let me explain to you about how we use the crews. Normally, there are 4 people within each vehicle, and the vehicles travel around and pick up the household waste, then the recycling waste, then the green waste, in those orders of priority. In order to keep social distancing that we're now all learning is 2 meters or just over 6 foot, we can't put 4 people in a vehicle. We can put a maximum of 2 people in a vehicle, which means 2 other people or a person follows in a different vehicle. Now, if you run that through, that takes up an awful lot more resource in terms of people, in terms of vehicles, and in terms of time. So we ran out of resources to be able to collect household, recycling and green bins. So the one that's got the lowest priority had to go, which was the green waste. Now, we know everybody's frustrated, we're as equally frustrated. So we're permanently reviewing that situation, and we are permanently looking to see how we can open it back up safely, because we've got to make sure that our crews are as safe as everybody else. Does that help as an answer?
I hope so, and I think I'd echo that final point that you've just made, which is that, you know, we as councillors will be working with Ian and officers to reopen the household waste recycling plant, and then to start green waste collections as soon as we can, but in a safe way. And it's something that we're reviewing on a daily and weekly basis. So encourage residents to keep looking for updates, and obviously keep talking to their local councillors about those services. And the thing that I didn't mention as well at the start is that we received a couple of similar questions on that topic, including from Melanie as well as Steve, which was the thing that I forgot to mention. What I should say as well to I'll come back to you, the participants on the call, if you ever want to butt in and make a comment about something, you can raise your hand virtually, and I'll see it and bring you in so that the audience can see if you want to add any extra points. Paula.
Just a couple of extra points, because the vast majority of our residents are being brilliant. They are doing all the gardening, they have filled their green bins, they're then either composting, which there's lots of different details on, or they're bagging their green waste up. When we can start the green waste collection, we will collect the bag waste up. But what we're asking people to do is not fly tip and not to create bonfires. So if you could please do that, if you could keep hold of your own waste, and we will collect it, and please don't burn it. Okay, but everybody, practically everybody in the city is being fabulous with this initiative.
Thank you. And I can see that bit of advice there on bonfires and fly tipping is something that is causing some chat questions on Facebook. So thank you for that. The second set of questions, and we can always come back to green waste and recycling later in the call if anybody wants to ask any follow-up questions. But the second set of questions were about changes to services, and as Paula has just said, some have been incredibly difficult changes to look at and even consider based on this situation that nobody expected to be in. And the second question that I'm going to initially ask Sharon to answer, and then I might add a comment myself, has come from Matthew. And Matthew's father died in the last few weeks, and we'd like to pay our condolences to him and his family at this really difficult time. And the question from Matthew was, I'm aware how serious COVID-19 is. However, why couldn't you let 20, 30 or 40 people in at York Crematorium for funerals, as long as people observed the 2 meters rule? I was in a York supermarket yesterday, and there must have been 150 people inside. And I have to say, from my perspective, this was one of the most difficult decisions and service changes that I suspect I'll ever be involved with as a local councillor, and obviously do recognise the very significant impact that it has on individuals and families, whilst the council does everything it can do to keep people as safe as possible. But I'll go to Sharon first as our Director of Public Health on that point.
Thank you, and thank you, Matthew, for this question, and I'd add my condolences on your loss. As Keith has already indicated, this was one of the really difficult decisions that we needed to make as a council. If I can explain some background, which might be helpful. At the start of the pandemic, so if you think about kind of March, early April, we were following the government's modelling around what we felt the impact of COVID-19 would be in York. And part of that was looking at management of mortality and looking at what the different scenarios were for us, really, in terms of the number of deaths that we might need to be planning for as a city. At that time, the numbers that we were looking at were very high. Fortunately, as the pandemic has progressed, what we've seen is a difference in that the numbers aren't as high as we thought they were going to be. But we had real concerns at one point about the capacity of the crematorium to be able to cope with the numbers of funerals that we might see. And we also had concerns about the risk of cross-infection, not just to relatives and friends who might have been attending services, but also to funeral directors and crematorium staff, etc. And so we were looking at all of those issues and made a decision back then that we needed to do everything that we could to protect the ability of the crematorium to continue to function and also to reduce the risk of cross-infection to an absolute minimum. And we did say at that time that we would keep the situation under review, and as Councillor Widdowson said in terms of the green waste issue, we're continuing to keep a lot of these decisions under review, and certainly the crematorium is one of those. So what we have done is made some changes to service provision. So there aren't any services taking place within the chapel at the crematorium at the moment. But what we have arranged is for there to be a canopy outside the crematorium that will allow family members to meet in the covered area in the car park. We're saying up to 10 mourners, together with the minister or celebrant and obviously the funeral director staff. That then allows the family to be able to have a period of time with the loved one in the coffin, for there to be a family service, and then after that, going into the crematorium, there's an opportunity for the minister or celebrant to make some final remarks before the coffin goes through, and so we've tried to minimise the impact as far as possible on people. There was, I think, a comment made about comparing the large numbers in supermarkets. Obviously, that is slightly different setting that we have at the crematorium, and as a council, we do have a responsibility clearly to protect the health of everyone involved. And so that's why we made that decision. But obviously, as I say, we recognise the impact that is having on people. And I've worked with the faith leaders in York and with York Minster, and we will be creating an opportunity to have a remembrance service, a memorial. Hand over to you, Keith.
Thank you very much. Occasionally, your camera, and this shows us the joys of using technology. The audio was cutting off slightly, Sharon. So I don't know how it was.
Sorry about that.
No. Don't know how it was coming across on Facebook Live. I certainly heard most of it, which is great. And I think just going back to my point, just how much the councillors recognise the impact that the decision about York Crematorium will have on families, but that real key point that Sharon just made there, that funeral services in a different way at the crematorium and funeral services in terms of burials at Fulford Cemetery will very much continue to go ahead, and our staff, I know, will help families as much as they possibly can at this time. There's a question I think that's just come through on Facebook, and I thank Steve actually, who's made a comment, Paula, you'll be pleased, saying that you answered his question on green waste. So thank you Steve for that. I don't know if you know Paula, but she'll be pleased. But another question's come through saying, what are we doing to look after the well-being of our frontline staff, so council staff and their mental health. Don't know whether Ian, it's an extra one I've added, but I think it's a really important point, and it does relate to what Sharon was just saying about us needing to deliver services, whether that's waste, whether that's the crematorium, in a really different way to look after the staff and keep those services going for all of the residents. Ian.
Yeah, I mean, I think I'd start by just paying my thanks to all of our employees, actually, in terms of the changes that they have made, in terms of how they are operating, and that applies to many of our frontline staff, but also clearly to staff who are working from home and staff who are working very differently. And I think it's also just worth paying our thanks also to all the staff in the NHS as well, who are clearly doing a fantastic job, but who we have been working very closely with across many of our departments. The issue of staff well-being, and I will make it more general in terms of all staff, because clearly I have a responsibility to all of our staff. We have been doing daily communications since the crisis begun, and within those daily communications that we do, there is regular information in terms of people's well-being, and that includes signposting them to lots of information and advice, and also setting out just some simple reminders to people in terms of the need, whether it's to take breaks, to have some time away, to spend some time just relaxing, all those things. Because in a sense, we recognise that this is a difficult time for many employees. Their role has changed. Those who are still working are at times having to work in a very different way on the front line. For anyone who's working from home, that brings with it some challenges as well. And so all of our staff have faced challenges, and therefore their well-being is paramount. And I say that support and information is available for them, and we will continue to support staff throughout this period in terms of making sure that they've all got access to information, advice, and can contact people. Managers have been regularly reminded of the need to check in with people to make sure they are doing things. And clearly many of our decisions that we've made, and some of those difficult ones that were referred to before, have, at the heart of it being around ensuring we try and protect the health and safety of our employees, and that they can stay safe and still continue to operate and work in a safe environment.
Thank you, Ian. Probably a good time to mention Thursday, and I know an awful lot of residents in York have been joining in with the clap for our carers on Thursday evenings. And I've been really pleased that the city walls, Clifford's Tower, West offices, the Millennium Bridge have been lit up in blue. I understand that some of them this coming Thursday are going to be lit up in blue and green. And the green there is a national campaign to not just acknowledge all of the work of NHS and hospital staff, but specifically to thank social care staff. So that would be council social workers, but also the many hundreds of people in the city working in nursing homes, care homes, and across the social care sector that we all deserve to say a very big thank you to, but also make sure that they get the support that they need to keep doing their work. And I know a question was asked, Sharon, before the call, and other people have asked about PPE and making sure that NHS staff, but for us, council staff and the social care system, get the PPE that they need. And obviously it's something that I've written to the Secretary of State on, and I know we've done a lot of work, but whether there's anything you could add about PPE and how people can help if they want to.
Yes, I hope my internet connection doesn't fade out this time. Yes, I'm having a little notice to say my internet connection is unstable, so let me know if it's a problem. PPE, has been an issue for us in York, as it has across the country, I think. We have had difficulties in obtaining some supplies. I would say that local businesses in York have responded incredibly well to our request for assistance. And, you know, we've had a number of companies, including schools, etc., who have come forward to help us with PPE, and that's been very, very gratefully received. The PPE situation has improved a little bit in that nationally there's been an awful lot of work with the military as well to try and improve the distribution of PPE supplies. And in York, we've been very grateful to the North Yorkshire Local Resilience Forum, who have been assisting us with that. So the situation is not desperate in York. We have enough PPE for our frontline services at any given time, but supplies are still quite fragile, and the numbers of people who need PPE are increasing, and so the continued support of businesses in the city will be very, very welcome. We have a dedicated PPE email address for anybody that wants to help, and that's ppe@york.gov.uk.
Thank you for that. Thanks, Sharon. Perfect. Didn't crackle. And just to say thank you to John on Facebook that picked up that question on PPE. An awful lot of questions that are on the Facebook page, but also came in advance of the call about dentistry. And this is where I'm going to bring Andrew in. And the two questions that I wanted to highlight were first one from Corrine was, what plans are in place to deal with the chronic lack of access to dentists and dentistry services in York during the crisis, and what arrangements are in place to help those without transport gain access to the dentistry hub in Hull? And then there was a second question from Melanie. It seems during the lockdown period that York is without a dentist. What are we supposed to do? So if you could pick those up, Andrew, that would be great.
Sure, thank you very much. Both very good questions, really. I'd like to start by just thanking people for their patience with the whole dentistry saga, so to speak. Because if you go back a month ago, the Chief Dental Officer advised nationally all dentists to stop routine dentistry. And part of the reason for that was concerns around dental procedures potentially being infectious and generating aerosols that might cause the spread of COVID. So that's one reason. The second reason was they needed to try and protect PPE supplies. If you want to deliver a dental service, you definitely want the safeguards and PPE in place to protect staff, but also patients. And it wouldn't make sense to run a service if you can't do it safely. In the last few weeks, a lot of the focus has been on supporting the hospital PPE supply, essentially. Now, so some good news to tell our residents, really. The first bit is that dental practices should be open for advice, support. They can certainly provide antibiotics or painkillers if need be. And they've got a role here in assessing people to see who needs referring on for urgent treatment. Okay, I specify urgent treatment. So if it's routine stuff, they'll probably put a pause on that. But if it's urgent stuff, there are two options, okay? And York is lucky because firstly, there are 3 regional hubs for people with COVID who need dental treatment. One's in Sheffield, one's in Leeds, and the other one's in York, okay? So we're lucky there. The second bit is with regards to people without COVID symptoms who need urgent dental care. And you're right, in previous weeks, there was an issue with access. But I understand now there is one urgent dental center set up now for York, and we are planning for a further 3 to come online soon within the next week as soon as we can ensure sufficient supplies of PPE. And once we've got this provision in place in York, hopefully that will sort out the access issue for our residents. But please, can I ask for people's continued patience with this? We're not quite back to normal yet. It will take weeks, if not months, because of this risk really around transmission and the need to make sure that we can protect both patients and staff. Over to you.
Thank you very much, Andrew. And again, on Facebook, if anybody has any follow-up questions now they've had that extra information about dentistry and services in York, please put them on that box, and I'll send them the questions back to Andrew in a little bit. On a completely different topic, something that a lot of people asked about in advance was about cycling and opportunities in the city. And I know Andy's had a couple of questions on that, so I'll take the opportunity to go to Andy to talk a little bit about that.
Thank you. Just before I move off the dentistry comment, I had personal experience of that. I managed to break a tooth about 2 days before lockdown, but fortunately it's one which is not painful, and I did have a conversation with a dentist about, you know, what procedures and so on, and certainly was reassured that if they needed antibiotics or whatever, to come back straight to them. And you know, anybody who's in pain, I would certainly urge them to do that and to get that advice and support that they need. So on the cycling front, you may well have, or many people may well have seen that around the globe, places like Berlin, Milan, Vancouver, you know, big cities have actually taken the initiative to try and provide extra space for people in this lockdown type of scenario. And certainly responding to that, we have started to look at what we can do quickly, what quick wins we can put in place. And one of those, I must admit, it's sort of slightly opportunistic, but nevertheless, for work on Castle Mills Bridge, people will know on the Inner Ring Road there's been work going on for several weeks before the lockdown to repaint and repair that bridge. And when that was concluded about a week ago, I did ask the officers if we could retain that, given the level of traffic is much lower than it has been, retain that lane for people on cycles to keep them separate from the traffic, because it is one of our points where there is completely inadequate, I'll admit that, completely inadequate facilities for cyclists. So we are looking at things like that, but we are also aware of situations where there may be shops that, you know, previously quite operated quite normally with pedestrian access from outside, where now because of the new distancing rules, the people having to queue outside on the street, and that then creates problems. So we are looking at whether we can reduce the carriageway width in particular places and widen the footway to accommodate that immediate need. But there are processes that we need to go through if it involves things like diverting traffic or road closures. Then there's a legal process that, you know, the local residents and shopkeepers can respond to if that's going to create a problem for them. So we're doing our best to try and respond quickly, put measures in place, and look at what is practical and feasible of quick wins that can help everybody to maintain that 2 metre distance and stay safe, whether they're walking, cycling, or other forms of transport.
Thanks, Andy. And I think current situation is going to mean that a lot of people, whether walking, cycling, or not going to work in the same way, are going to be making an awful lot of changes. And actually something that I know both you and Paula have been involved with was a study that a University of York academic did that looked at air quality in York, and what a significant improvement that we've seen. And obviously there are an awful lot of aspects of the current crisis that we're not wanting to go away, but there are some changes that we've seen that we might want to keep. So I don't know whether you or Paul have got anything to question from me, or anything to add on in a sense air quality and what that might mean.
Well, what we've got is a massive decrease, or sorry, improvement in air quality. It's over 30% improved. And in certain areas of the city, it's close to 50%. So that is fabulous. But as you said, Keith, at a cost. So what we will do is we're working through on our plans with Andy and other members of the group, and making sure that we can lock in certain gains and see how we can encourage people, now that they're used to it, how we can encourage people to walk, to cycle, when they feel so inclined, to use public transport, when they're allowed to move around a bit more, maybe keep their shopping local so that they don't have to take their cars out to wherever and bring them back again. You know, we've all changed our habits slightly. Which good ones can we keep hold of that would help everybody? And that's what we're discussing.
Yeah, and on that particular point, you know, there are a lot of smaller independent shops have changed the way they operate, whether it's 1 or 2 people maximum in the shop, but also doing deliveries, you know, new services that they're trying to attract people who might previously have gone further afield. So we encourage people to look at those, and also with the point about cycling and jogging and running, there are lots more people out and about now, with people working from home than there were before. And in order to keep that 2-meter distance, it might be that people who would normally use a sort of a narrow cycle route could look at the very quiet roads and cycle on those sort of urban street routes, and allow for the riverside paths and things, and perhaps for people who want to stroll or take their children, or elderly people who just want to get some fresh air close to their home. You know, so it's about everybody trying to be considerate, and likewise the car drivers considering, just because the road is clear, that the speed limits are still there, and to take account of the fact that if somebody's walking along a footpath, whereas normally they might pass quite close to somebody coming the other way, they're quite likely to step into the road to keep that distance. So we need to leave space for people if they need to step off a footpath to pass somebody coming the other way if it's a narrow footpath.
Thank you. And in a sense, talking there about how people have changed their behaviour with travel, but actually obviously affects individuals and their own health in different ways, some positive, some negative. And there's a lot of rightly conversations about mental health and how that's equal to physical health. I don't know whether Andrew or Sharon, throwing a new question, but anything to add on that, and any advice really for residents. Andrew.
Hi there. Yes, I think the mental health issue, and I'm sure Sharon would agree on this, is something that we're concerned about. It's a priority. And tomorrow, a lot of the primary care leaders and GPs, we're meeting with our colleagues from TUE to talk precisely about this, about how do we continue to protect mental health in the city. So we certainly know in other areas that they're starting to see some ill effects of lockdown on mental health. So my message out to our residents really are the following. If you're struggling with your mental health, you can contact your GP. Your GP is still there. They can still speak to you by phone, and they can plug you into services. We've got good social prescribers in our city. We've got good voluntary services. We've got links with counseling and access to psychological therapies. All that is still there. And we'd certainly be happy to make sure people can get access to them if they need it.
Thank you. Sharon, anything you wanted to add to that?
I would absolutely support that. There's a lot of support available for people to kind of focus on their own mental health and well-being, and that of family and friends through this crisis. The council's website has got a lot of information on there about access to self-help resources produced by Time to Change, Mind, etc. There's a lot that people can do to support their own mental health. Although obviously if they're experiencing significant symptoms, then yes, you know, they need to be contacting their GP. But there's a lot that people can do for themselves, and I would encourage people to look at the web pages, the coronavirus support web pages on the council website, because there's a lot of information there as well.
Thank you very much. So I'm going to move us on to a new topic that I know was submitted in advance, which was a question asked by Catherine on homelessness, and I'm going to ask Ian to answer this one. So the question from Catherine was, I watched with sadness the BBC Newsnight report on hidden homelessness during the pandemic. This seems to me to be an issue that would disproportionately affect women for all kinds of reasons, not least those escaping from difficulties at home. What are the current figures for women in temporary accommodation in York? Has there been a rise? And how is social distancing in temporary accommodation being monitored by the council? Ian.
Okay, thank you. We haven't seen a rise in the number of women who've access to service, and generally in terms of homelessness we have low numbers in the city. We have supported our partner, who is the Independent Domestic Abuse Services, who are known as IDAS, and we've supported them during this period. So that's included ongoing dialogue, sharing messages, sharing comms, and seeking to just generally support working across those areas. On the social distancing, the accommodation that is provided is self-contained, so that allows for social distancing measures to be taking place. And in terms of some of the work that we do with some of our partners who provide accommodation, there have been discussions with them and regular reminders of the need to operate under social distancing rules. I think it's probably also worth just saying that more generally in terms of domestic abuse, that is something we are acutely aware of in terms of potential risks. It's something that both adult services and also through our children's service have been working that together. And as Keith and Andy will be aware, we did have a discussion at our group leaders in terms of domestic abuse earlier this week. So it is something we are very much aware of those risks, and you'll see national coverage in terms of some of those issues as well. And we'll be mindful of some of the issues going forward as well.
Thank you, Ian. And remember to anybody, if you flag your virtual hand if you want to add in, and I haven't asked you to come and ask a question. An awful lot of questions being asked on Facebook at the moment, and also in advance under the broad theme of environment and climate change. This is when you might be very busy in the final 10 minutes, Paula. But we had, and I'm going to group them together so we can get through some of the comments that are coming through on Facebook. But we had a question from Peter on the household waste recycling centres, and that if the council has sufficient resources so that Hazel Court can be open, then shouldn't it be available to residents and not just commercial customers, and why isn't it? And then I'll give you a chance to answer that, Paula, and then I'm going to come back to you to ask more broad questions about what the council's doing to address the climate emergency. But if you want to have a go at the household waste one first.
Household waste one, I can understand again why people would think, why isn't it open for us? We've actually been directed by government, central government, that we cannot, as residents, take our waste to the waste site because it's not a necessary journey. So if our residents do go to the waste site, they'll get a fine. And when they do get to the waste site, the reason that the commercial guys can do it is it's part of their job, and that's how we're making sure that we don't get the fly tipping. I hope that helps.
And I think that very much is a service that goes into that category of one that we're reviewing, certainly in terms of household waste sites on a daily and weekly basis, and very much hope that with additional social distancing measures and advice from the police, who I know that we're talking to in North Yorkshire, that will be one of those services that not just commercially, but that we can get up running and back for residents as soon as we safely can do.
And to absolutely support you in that, Keith, there's lots and lots of planning going on. We know how we can do it. We've just got to be given the authority from government to be allowed to do it and allow our residents to do it safely and without them incurring a police fine.
Thank you. So there were quite a lot of questions, as I mentioned, broadly on the topic of environment. So there was a question from Tom, which was, as and when we start to emerge from the lockdown, what will the council be doing to address the climate emergency and meet the goal of being carbon neutral by 2030? And a question from Martina, which was, what specific and immediate action is the council planning to take after the lockdown to ensure that the environmental gains as a result are maintained and incorporated into the new normal? So we talked a little bit about that with changing behaviour and air quality, but I'll go to you first, Paula, and then I'm sure Andy and others might want to add to it.
Absolutely. Well, as you said, and Martina, hopefully we've answered some of your questions in how we lock in some of the gains. Now, the gains that we want to get are that to each individual, they will feel like a small behavioural change. But if we all do a small behavioural change, you've seen the impact. Lots of people are not using their car. Look at the improvement in noise, look at the improvement in air. Therefore, as everybody on this call and everybody listening will know, look at the improvements in health, both in terms of what we're breathing in, but also in terms of the exercise that you're getting. So we're hoping to encourage people to keep doing that. Shop locally, use people to deliver it for you, get off the bus a little bit earlier, walk into work, work from home. So that's all being planned in, and it was all being planned in as part of our climate challenge and our climate emergency. What this has let us do a bit of, Martina, is accelerate it a little. So we'll see if we can bring those in. In terms of the longer term and making sure that we're carbon neutral by 2030, we have got lots of plans and lots of strategies emerging. Everything from planting 50,000 trees within the city, the whole city of York, not just the city centre, just so that people are aware I'm not going to take over the whole of Coney Street. Working with the Northern Forest and the Woodland Trust so that we can build hectares and hectares of forestry across our region, along with Harrogate, along with Rydale and other places. We've got electric vehicle charging points. We're one of the first people in the country we will hit 5% of all our car parking spaces will be electric vehicle charging points. We are the first place in the country to do a voluntary clean air zone, which kicked in January. I know a few other things have happened since then, so you've probably missed it. And all of the buses that take 5 or more journeys across our city are all electric. 20% of our taxis are electric. And we will keep chipping away at it, and hopefully we'll get people to come with us, because what nobody enjoys is being told. And if we tell you what to do, unless the situation's like it is today where we really do have to do as we're told, most people object. But if you can see the sense in what we're saying, and you can see the benefits for yourself, for your family, for the environment, for businesses, for tourism, for everything else, we can make a significant change.
Thank you very much. Andy. You'll have to unmute, Andy, just to show everyone it's live.
Oh, yeah, okay. Thank you for reminding me. As everyone, as Paula has just said, everyone, I think, has been shocked at how clearly the link between the traffic and air pollution has been demonstrated by the last few weeks. Just as an example, in my ward, Fishergate School, there's a couple of hundred children spend every day normally in the school there. The air quality outside is, well, there's been a 43% drop in nitrogen dioxide pollution following the lockdown. So that's a dramatic improvement in the air quality, and that is something that has happened because fewer, only essential journeys are being taken by car. So why do we have to wait for a global pandemic to actually bring about that massive improvement in quality of life? I think after this, one of the things that's been pointed out, the number of people who are working from home, the social distancing rules that are going to have to be in place for at least the next year, the change in people's behaviour, in who are people working from home being able to spend spend a little bit of time each day getting exercise, walking and cycling. Those sorts of behaviour changes are things that we need to capitalise on for the benefit of everyone, for all residents' benefit. Obviously, there are going to be more essential journeys made as the economy starts going again, but we need to actually learn from our experience and make that transformation so that as Paula said, we're going to have cleaner buses that will actually improve the air quality, but why not cleaner lorries, cars, reduce the level of car traffic as is quite likely to happen just by people's behaviour change, more working from home, Zoom conferences, all those sorts of things. And
we've got a fantastic example of that, haven't we, Andy? Absolutely brilliant example. When you look at York Central, it's going to be built right in the city centre. It's going to have fantastic broadband, green energy to it, and the ability for all residents and businesses that operate out of there to walk right the way across the city or use the park and ride. So the city is developing significant plans moving forward to capture these gains.
I would also just mention that because of the situation, the bus services in York, we have worked very closely with the operators, even though we don't control the bus services. We've worked closely with them to maintain an essential link so that people, key workers can get to work, can get to hospital, people can get to the shops and so on. But that is an example of how we need to move forward and plan with our partners, with small businesses, with everyone else in the city, for a more sustainable future. Make sure that we can get around for essential trips, but we reduce that horrendous pollution that has been associated with everyone driving, or a large proportion of the people driving instead of walking, cycling and using the buses.
Thank you. Now, if we have time, I'm going to come back at the end. There's a couple of questions that have been asked about parks, exercise and social distancing in parks that I was going to go to Sharon on in terms of social distancing advice, but obviously I know that we're keeping our parks open for that really important reason of people using them and getting out. But one question I was going to ask you to have a look at, Andrew, that's just come through on Facebook is from Maureen, who says, my daughter was very seriously ill in January, as she had a nervous breakdown, would not go to hospital. Her temperature was 41. She was freezing cold, had an awful cough, couldn't stand up properly with chest pains and headaches. We are both sure that she had COVID-19. How could this be clarified? Okay, so this is a tricky one, really. If you think back to January back then, it was right at the very end of January that we had those 2 cases in our city. At that point in time, the prevalence of the infection was really, really low in York. And even now, York counts as one of the quieter areas nationally. I guess the question Maureen's asking really is whether they can get some form of testing for it. And at this point in time, there isn't a test for past infection that's available nationally. The test that would possibly be done is something called an antibody test, but I'm sure you might have seen on the press, there are lots of caveats with them. There are lots of limitations of these tests. But more importantly, if we look at the science of what we know so far, we are not 100% sure that having a past infection gives you lifelong immunity. So I don't people may think, oh, I had an infection a few weeks ago, a couple of months ago, therefore I'm immune and protected and can just carry on. We don't have that certainty, and that's what the WHO are also saying. So it's important to comply with the social distancing and all these protection measures. I know it's tiresome, I know it's difficult, but I really, really want to encourage everyone, just keep the faith, just stick with it. We really need to get the infection numbers down as low as we can, so that we can then put in control measures that can contain it and allow some semblance of normality to return
for the city, for businesses and the economy. But until we get that level of infection down, we're still in danger.
Thank you very much. And on that point, the bearing with, and obviously all of us living our lives differently, I'll sneak in that one about parks. Any advice, Sharon, in terms of social distancing and helping us in parks and open spaces so that we can make sure that those facilities are still open for residents to use?
And I think this is where we are really dependent on people being responsible and following the social distancing rules. It's really about behaviour change. And so every week we encourage people to get out for their hours exercise a day. It's really important. We were talking about mental health and well-being earlier, and people being able to get out as a family or as an individual to get out in the fresh air and have some exercise is really important. But we are asking people to respect those social distancing rules. So it's to make special effort when people are in parks or on country pathways, etc., to be sensible and to make sure that they do give plenty of space and that they don't crowd together and they, perhaps fall back if they're going through a narrow space to try and make sure that everybody is kind of keeping that 2 meters, 6 feet apart. It's very difficult for us as a council to enforce those rules. Obviously, the police will challenge people if they see people flouting the rules. But for the vast majority of people, it is about being sensible, about being kind to others, and trying to kind of be all in this together, and everybody seeking to help you.
Thank you very much. So I can see that we are minutes away from being at the end of our first Facebook live, but I think it's worked pretty well. So thank you for bearing with us and following through, and all of your questions in advance and on Facebook tonight. I can see that there are an awful lot of topics that I would like to have spoken about and asked questions on. So working with the police, the communication from the council, all of the volunteering that's going on, the work at the community hubs, ensuring food gets delivered, how to support businesses, and the issuing of grants from the council, which gives you a taste of everything that's going on. So it'd be quite useful if you are on Facebook or you submitted a question, do tell the council if you think this Facebook Live was a good approach, because if you do, we can always do it again, and obviously make sure that we come back and pick up those other themes and those other questions that you might have in a couple of weeks' time, just as one way of lots of different ways, including the local media, of trying to answer your questions and talk to you as much as possible. I apologise if we didn't answer your question, or you wanted to hear about one of those big themes that we haven't had an opportunity to talk about now this evening. We'll come back again in the future. Thanks to Ian, Andrew, Paula, Andy and Sharon for spending your time and testing it out via Zoom and Facebook. Much appreciated. And really, as a sort of concluding remark from me, just to thank everybody today for joining us, to thank everybody that downloads it and listens to it in the future, and also following that last point really from Andrew and Sharon, just thank you to everybody for staying at home. The data is showing that York is one of the best cities for people following the social distancing guidance and staying at home. And this is all going to be absolutely vital as we continue to do so, primarily to make sure that our frontline workers, whether they're social workers, whether they're collecting are rubbish from the council or working from the NHS are protected and can keep doing the jobs that they're doing across the city, and we will continue to deliver that support to individuals and the most vulnerable in our communities. And in that sense, you'll all know that staying at home really does save lives, and I know that you will all continue to do it in these frustrating times that we all find ourselves in. So thank you all for joining us. Have a nice evening, and see you all again in the future. Bye bye.